it's a little while, Junior. It's the time of year that many practices bring on a new associate. And if you're like me, we did so this year. We have a new associate starting in Chicago, and actually, we have new associates throughout our organization. We have a whole slew of them in California as well. And it's really important as you bring on a new associate to think about how you're going to onboard them to make sure that you get them to the highest level of success that they want and you want as well. And it's not to be left to chance. So going through a great thought process on how to onboard an associate is key. And if you haven't brought on an associate and you're thinking about it in the next year, this video is for you as well. And if you've been afraid to bring on an associate because you don't know how to onboard them, or you have brought an associate on in the past and they have failed, this video is also for you. So when we bring on a new associate, first of all, there's a lot of preparation work. We make sure that we get them credentialed well before they start. So that means we have to start 60 or 90 days out to make sure we get them credentialed so that when they start, they can see all the patients and all the insurance plans. When they come on to start, we go through a very diligent process. We have them meet with different people in our organization. They meet with an expert with our EHR, and they go through how to learn and make sure they can use the EHR effectively. They work with people from our marketing team, so they understand how are they going to market themselves to make sure that they can bring in new patients and not just wait for you to feed them new patients. They work with some of our operations teams about the different aspects of the organization, the different treatment modalities, the different ways in which they should use their medical assistants and x-rays, and the whole process that goes into that. They work with our IT department to get their email addresses and make sure that they're able to log on to all of the systems. They work with HR to make sure they have their benefits and their contracts signed and all of those things. And then really important, they work with doctors. And they work with doctors both in a classroom setting where we go through evidence-based protocols that we've established for our company. And it's guardrails for that they know what we expect in terms of treatment. With this diagnosis, this is how we think you should be treating broadly this, and then what you go on if that's not effective, and what you go on if that's not effective. Because residents and fellows coming out of their training are excellent, smart, skilled people, but they haven't been in clinical practice. And so while they can handle the surgery and the call and the trauma, they may not be as adept at knowing how to deal with patient care. And so we go through role playing where I'll be a patient and present them with challenging opportunities and let them question me and go through it. And sometimes I'm a nice patient and sometimes I'm a pain in the butt patient just to get them to understand there are these different kinds of things. And then, of course, we have the associates shadow in clinic with different experienced different doctors that offer different perspectives on patient care. It's not one size fits all. And so getting around some experienced doctors to see how they do it. And when we're having them shadow, we're talking to them about, this is how I talk to a patient. This is how I introduce myself to patients. This is how I use my medical assistant. This is how I chart. This is how I do orders. All of those different things to make sure that our associate has the chance to be successful. And these are just some of the many things that we do and that you should do as you're bringing on your associate now so that they're happy, you're happy, they're successful, and then they're going to stay with you for the long term. And you're not just shuffling through associates over and over again and feeling like you've wasted time, money, and effort. And when you do this, you're going to have better patient care. You're going to be able to grow your business. And one of the most important things to create higher value of your business is bringing on an associate, making them successful, doing it once, doing it twice. It completely increases the value of your business for your long-term plan of exit and, very importantly, your lifestyle. So as you're bringing on an associate this fall, make sure you do these things. And if you're looking into the future, keep this video fresh because you'll want to reference it in the future. Have a great week.